We would like to invite the first speaker for this session, uh, which is Dr. Schmidt, who will be speaking to us about the pathophysiology of mucous membrane pemphigoid.
Thank you very much for the kind introduction. Dear ladies and gentlemen, dear chairman, I would like to thank the organizers of this prestigious international ophthalmic conclave to have the opportunity to talk about the pathophysiology of mucous membrane pemphigoid. And as you may know, mucous membrane pemphigoid is amongst the about dozen entities that are classified together as autoimmune blistering diseases. And already in 2002, mucous membrane pemphigoid has been defined by international group of experts as pemphigoid disease, means you find linear deposits of IgG, IgA, and or C3 at the basal membrane zone of the epidermis or epithelia, a direct immunofluorescence, and importantly, predominant mucosal membrane involvement. And I'm happy to announce you, and some of you may have seen that the task force of autoimmune blistering diseases of the European Academy of Dermatology and Venereology last year have provided the guidelines for S3 guidelines for this disease, and also ophthalmologists have been included here, and these are all also among the speakers and presenters today. And the most frequently involved site is the oral cavity, but as about 2/3 of the patients also present with ocular lesions, and some of them with only ocular lesions, and these patients are then also called ocular pemphigoid patients. And there are two main target antigens in mucous membrane pemphigoid. This is VP180 here, also called type-17 collagen, and LAMI52. This is a heterotrimer of an alpha-3, beta-3, and a gamma-2 chain. And then more rarely, type 7 collagen is also targeted in these diseases. And it's about 2 years ago, there's a standardized test system available for autoantibodies against LAMI52, and this is based on the biochip technology. So here on the standardized lab slide, you can detect antibodies against the alpha-3, the beta-3, and the gamma-2 chain, and also the heterotrimer of LAMI52. And Stephanie Golez has validated this new assay. And in this prospective multi-center trial, she found the sensitivity to be 84%, and using a high number of controlled serial, the specificity to account for 100%. But why is it important to test for antibodies against LAMI52 in mucous membrane pemphigoid? And the answer is quite clear. 25% of the patients are associated with malignancies. And after this initial report here in Lancet, from a time where mucous membrane pemphigoid was called cicatricial pemphigoid, and LAMI52 was called epiligrin, there are at least 6 reports that confirmed this association. And as such, the S3 guidelines also recommend that every patient with mucous membrane pemphigoid is assayed for autoantibodies against LAMI52. And these data is also supported by a very recent bicentric study, including more than 150 patients. And here also a very clear association with malignancy was associated, and this risk was estimated to be 5.8-fold higher to have malignancy in patients with anti-Lamin-52 mucous membrane pemphigoid compared to the general population. And interestingly, for this audience, in the study, the absence of ocular lesion was associated with IgG reactivity against the immunodominant region BP180, and that ocular involvement was associated not only with less oral lesions, less nasal lesions, but also with a 13-fold increased risk for malignancies. And of course, this is the first study showing this, and this needs to be validated. And in the last minutes, I would like to present you a mouse model for anti-Lamin-52 mucous membrane pemphigoid. And here, Nina Heppe, she immunized rabbits with the recombinant fragments of the alpha 3 chain of Lamin-52. And these rabbit sera then labeled, as in the patients, the dermal site of salt split skin by indirect immunofluorescence, and by electron microscopy, the antibodies here labeled, as in the patients, the lower part of the lamina lucida of the basal membrane zone. And then Dr. Heppe injected the antibodies against Lamin-52 over 10 days in adult mice. And here she could reduplicate important clinical findings of the human disease. You see blister here at the tongue, there's a blister erosion here at the buccal mucosa, but also around the eyes and at the skin. You can see lesions, but also, and this is important, of course, here in the conjunctiva, like in the patients, you see linear deposits of IgG, and also see 3 at the basal membrane zone, and also here subepidermal blistering. And here we developed also a conjunctival score based on the extent of the split formation in the conjunctiva, and this also correlated with the amount of autoantibodies injected. So the more antibodies you injected in these mice, the more split formation you get in the conjunctiva tissue. And the conjunctival lesions in this model were dependent on the FC receptor of the mice. So mice that were deficient in the FC gamma receptor did not develop mucous membrane pemphigoid, as you can also here see very clearly with the conjunctival involvement. So FC receptor mediated events are required for conjunctival lesions, which was also pivotal for conjunctival lesions was the involvement of the C5a receptor 1. So mice deficient of this receptor did not only develop very little skin lesions, but also had very limited conjunctival lesions. And then Sabrina Patzel, she also used the same model, but she used the same injection scheme, but not only observed the model for 12 days, but for 28 days. And here she could see that, okay, the skin lesions already decreased after day 16, but the oral lesions here, this is shown at day 28, they still increased. And here, also the ocular lesions, you see it here periocular, but you also see here the conjunctival lesions, and here also in the conjunctival score that increased over time until day 26. And also, interestingly, Dr. Patzel, she investigated the fibrosis. And she could see here on day 28 at the palpebral conjunctiva increased fibrosis, not only in the picrocereus red staining, but also in the Masson's chrome staining. You can see that clearly, and the mucous membrane pemphigoid mice compared to the mice that were injected with the control IgG. So in summary, I showed you that ocular lesions occur in about 2/3 of patients with mucous membrane pemphigoid. And since last year, there's an F3 guideline available for this disease initiated by the European Academy of Dermatology. And testing for anti-lamin 52 antibodies is pivotal in patients with mucous membrane pemphigoid to identify those subgroup that is associated with malignancies. And ocular involvement per se may also be associated with malignancies, but this has been shown in only a very recent study and needs to be validated. And we think that the mouse model for this disease not only replicates important clinical and immunological characteristics of the human disease, including conjunctival lesions and scarring, but will also be useful to study novel therapeutic options for this devastating disease in the future. And with this, I would like to thank my group. Here are the scientists, here the clinician scientists, the physicians working on these models, and also the technicians. And thank you for your attention.